House come to order. Members, proceed to your seats. Will the members please rise for the invocation delivered by Dr. Jeff Eaton, Hope Community Church of Frankfort, Kentucky, and remain standing for the Pledge of Allegiance.
Thank you for your service, and be safe going home. Let's pray together. Father, we come to you and we say thank you. We can't thank you enough. Your word tells us over and over and over to overflow with thanksgiving. I thank you for these people, their service to us, to our commonwealth, to our state. Lord, we love it. But Lord, it's more than just serving our state. Ultimately, we need to be reminded that they're serving your kingdom as well. And Lord, use us as a state to be a guiding light for not only our nation, but also for our world. Give them rest this weekend, safe travel as they go home. Bless their families, Lord, as they are with them, their businesses as they are away from them, their work. And Lord, give them wisdom and clarity. All that's involved in that, and more than anything else, we give you thanks for the focus of this season of Jesus, the indescribable gift, his sacrifice, and his resurrection. It's in the name of Jesus that I pray. Amen. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Clerk will sound the chimes. Members, indicate your presence. Clerk will take the roll. Being 98 members indicating their presence, quorum is declared and the House ready to proceed. Next order of business, the excuse of absent members. Gentleman from Taylor.
Mr. Speaker, I move you, sir, that the absent members be excused in accordance with the House rules.
Without objection, so ordered. Gentleman from Taylor.
Mr. Speaker, I move to suspend the rules for the purpose of allowing members to co-sponsor bills and resolutions or to submit vote modifications and have filed the proper papers with the clerk to do so.
Without objection, so ordered. Next order of business, the approval of the journal. Gentleman from McCracken.
Mr. Speaker, I move you, sir, that the journal from Thursday, February 26, 2026, be approved.
Without objection, the journal from Thursday, February 26, 2026 is approved. Next order of business is second reading of bills. Clerk, please report.
House Bill 145, Representative Griffey, an act relating to state personnel. House Bill 418 with House Committee Substitute 1, Representative Nemas, an act relating to domestic violence. House Bill 506 with House Committee Substitute 1, Representative Hale, an act relating to the Department of Fish and Wildlife Resources. House Bill 567, Representative Flannery, an act relating to open records. House Bill 576 with House Committee Substitute 1 and House Committee Amendment 1, the title amendment, Representative Duval, an act relating to workforce investment, making an appropriation therefore and declaring an emergency. House Bill 593 with House Committee Substitute 1, Representative Bray, an act relating to data centers. House Bill 598 with House Committee Substitute 1, Representative Dietz, an act relating to guardians, ad litem, and other appointed counsel. House Bill 611 with House Committee Substitute 1, Representative Dietz, an act relating to domestic relations. Senate Concurrent Resolution 9, Senator Meredith, a concurrent resolution directing the Legislative Research Commission to procure a vendor to conduct a feasibility study for an Accountable Communities for Health Medicaid Delivery Model Pilot Project. And Senate Joint Resolution 23, Senator Frommeyer, a joint resolution declaring Kentucky a food is medicine state and directing state agencies to advance food is medicine initiatives.
Thank you, Mr. Clerk. Next order of business, report of committees, there being no need. Next order of business, the orders of the day. Gentleman from McCracken.
Mr. Speaker, I move you, sir, that House Bill 2 be taken from its place in the orders of the day, read for a third time by title and sponsor only, and placed upon its passage.
Motion's made and seconded that House Bill 2 be taken from its place in the orders of the day, read for the third time by title and sponsor only, and placed upon its passage. Clerk, please report.
House Bill 2, an act relating to Medicaid, making an appropriation therefore and declaring an emergency. Representative Fleming.
Gentleman from McCracken.
Mr. Speaker, I yield to the gentleman from Jefferson 48 for explanation of the bill and motion thereon.
Chair recognizes the gentleman from Jefferson 48 for explanation of bill and a motion thereon.
Thank you, Mr. Speaker. Really nothing going on today, but I might go ahead and entertain y'all with House Bill 2, which is a good bill. And I just want basically ask for the clerk, if you don't mind, to House Committee Substitute. Well, I'm sorry. I want to ask if you don't mind, ask the clerk to call House Committee Substitute 2 to House Bill 2.
Clerk, please report. House
I had one.
Committee Substitute 1.
House Committee Substitute
two.
1 to House Bill 2.
Gentleman from Jefferson.
Thank you. I'm sorry. I was working on the proposed House Committee number 2, and I apologize for that. It is House Bill 1. This committee substitute, Mr. Speaker, strengthened the original version of the bill by creating 2 new sections that will establish guidelines for procurement of Medicaid, managed care organizations, contracts, and parameters for the Medicaid pharmacy coverage. In addition, it adjusts timelines and makes technical changes and corrections throughout the bill. Mr. Speaker, I move the adoption of House Committee Substitute 1 to House Bill number 2.
Motion is for the adoption of House Committee Substitute 1. Is there any discussion of the committee substitute? Seeing none, those in favor signify by voting aye. Aye. Those opposed, nay. House Committee Substitute 1 is adopted. Gentleman from Jefferson.
Thank you, Mr. Speaker. Medicaid is a taxpayer-funded health insurance program originally designed to address the needs of low-income individuals, the elderly, and the disabled individuals. Our Medicaid program provides health care coverage to 1/3 of Kentuckians and is the second largest state expense, making our responsibility to ensure that the program meets the needs of our most vulnerable and the taxpayers who fund it. Over the past 5 years, our Medicaid budget has grown from about $10 billion to $24 billion. Despite seeing significant growth in program funding, our state continues to consistently rank at the bottom of the national health ratings and rankings. This isn't a program funding issue, but frankly, based on my experience, it's a serious management issue. If we don't rein in this issue, it's going to be unsustainable. Throughout the interim, the Medicaid Oversight Advisory Board took a comprehensive look at program policies, practices, and spending, and heard from many key stakeholders. We found our Medicaid program across the board is riddled with inefficiencies and flawed processes, is mismanaged, suffers from poor oversight, and fails to align with the requirement of House Resolution 1. Our findings and recommendations are in part what led to the bill that you see before you today. With House Resolution 1, the federal government has shifted the financial burden to the Medicaid to Kentucky. Given this shift in costs and with program integrity flaws, the Kentucky Medicaid Reform Act, House Bill 2, aims to enhance transparency, income health outcomes, streamline program operations and service delivery, strengthen program oversight and accountability, reduce fraud, and align Kentucky's Medicaid program with the new federal requirements in House Resolution 1. House Bill 2 contains two major parts. The first 9 sections of the bill would align our program with federal community engagement, cost sharing, and eligibility requirements. The rest of the bill focuses on taking steps that would improve operations and reduce fraud within the program. Before I discuss some of the H.R. 1 related provisions in this bill, I want to be perfectly clear that our response in addressing House Resolution 1 is focused on Medicaid expansion population. Medicaid expansion population, and not traditional recipients. In addition, even under expansion population, there are populations that are exempt from many of the federal provisions. These populations include pregnant women, caregivers for a dependent child under 13, and individuals with serious or chronic health conditions. Individuals currently receiving services through the home community-based waivers. Children are not impacted by any of these proposed changes. Section 1 to 9, which mainly addresses House Resolution 1, would implement federal community engagement requirements, which again are narrowly focused and targeted on the Medicaid expansion, and even in that population, do not apply to everyone. Starts notification of individuals early who will be required to meet the community engagement requirements. Implement cost-sharing requirements for certain expansion adults above the 100% federal poverty level on selected services, promoting personal responsibility without limiting access to essential care. It increases eligibility integrity by implementing safeguards to ensure only eligible Kentuckians are enrolled in our Medicaid program. The Kentucky Medicaid Reform Act's remaining sections would help improve the program and its integrity by several areas. Mr. Speaker, I would like to yield at this moment to the lady from Kitten 64 for an explanation of one particular section of the bill.
Chair recognizes the lady from Kitten 64.
Thank you, Mr. Speaker. I'd like to talk about a section that deals with MCO audits and appeals. And in this section of House Bill 2, which is creating efficiencies in the Medicaid managed care system and ensuring transparency in the MCO audits and appeals process, we needed to make some changes to allow MCO, or to allow providers rather, to participate more fully in the audit process. So the background is that MCOs are denying claims for vague and invalid reasons, conducting excessive audits, delaying audits and appeals results indefinitely, and recouping large sums of money before providers even have a chance to appeal. This includes a case where an MCO recouped $88,000 from a child welfare agency before they even had a chance to appeal. This practice is directly harming providers, staff, and the families they serve. This section of the bill seeks to set fair limits on audits and limits the audit claims to no more than 2 years old, which will prevent MCOs from reopening old records and forcing providers to defend outdated claims. It stops premature recoupment and appeal delays by prohibiting MCOs from recouping these funds until the full appeal process is complete, and imposes penalties when the appeal resolution is delayed beyond 30 days. It allows providers to fix simple errors without punishment. Providers will be given 30 days to correct clerical or paperwork errors before any funds can be taken back, keeping minor mistakes from becoming financial crises. It requires timely, transparent audits, requiring MCOs to complete audits and deliver findings within 180 days. It also requires MCOs to maintain a clear online tool, as well as provide annual reports to the Assembly on service, authorizations, appeals, grievances, and approved or denied claims, including their respective dollar values. Some of the language included in this section are similar to, if not identical, to the Kentucky statute for audit of pharmacy records by the MCOs. And it will also give this legislature, as well as our providers and the public, greater insight into how Medicaid funds are being managed. Mr. Speaker, I'd like to yield back to the gentleman from Jefferson 48.
Gentleman from Jefferson.
Thank you, Mr. Speaker. And I'm going to appreciate the input and the guidance and the leadership of the lady from 64. Been a very strong force, not only in this Medicaid process, but also in the health delivery outcomes as well. Mr. Speaker, I'm going to continue on just to briefly touch on a couple of the other sections that's laid out in the bill. First, the sections basically will implement the federal community engagement requirements, which again are narrowly focused. Sorry about that. I was on the wrong sheet. So basically, holding the managed care organizations, as the lady from 64 said, accountable for quality and health outcome for enrollees, as well as the administration of the Medicaid program and delivery of Medicaid covered services through stronger contract standards. Improving the quality and reliability of cost effectiveness of non-emergency medical transport services through increased broker accountability and increased access for eligible enrollees through the expanded provider participation. It's transitioning the administration of underutilized Medicaid-covered dental services to an Administrative Services Organization, or ASO, delivery model to help improve programmatic efficiencies and oral health access and bring more dentists back into the Medicaid program. Standardizing eligible assessments for our waiver programs and establishing a tiered priority wait list to ensure Kentuckians with the greatest needs to get access to these critical services first. Giving the legislature full access to CHFS data to promote collaborative, effective, data-driven, and evidence-based policies and funding decisions. Creating a comprehensive, consolidated public healthcare transparency dashboard to track health and program performance indicators. Requiring that a comprehensive examination of the Medicaid program be conducted by the Kentucky auditor at least once every 5 years. And prohibiting Medicaid from covering drugs prescribed primarily for weight management without any underlying serious health issue. House Bill 2 establishes a strong first step of bringing new life to our Medicaid program. And through the Medicaid Oversight Advisory Board, we will continue to build upon this foundation. House Bill 2 is a transformational measure that will increase transparency, accountability, and responsibility at all levels of the program, thus helping sow the seeds of a stable, effective, and efficient Medicaid program. While our work is far from over, House Bill 2 represents the first step in a strong foundation toward transforming our Medicaid program, ensuring the best use of resources for those who need Medicaid and creating a healthier Kentucky. Mr. Speaker, before I make a motion for the passage, I'm looking at the board. It reminds me of a bingo card, as it appears to me that we need to go ahead and start getting the ball rolling. So with that, Mr. Speaker, I'll entertain any questions. I'd be happy to answer them.
Chair recognizes the gentleman from Knox for discussion of the matter.
Thank you, Mr. Speaker. If you could you have the clerk report Floor Amendment 18?
Clerk, please report.
House Floor Amendment 18 to House Bill 2.
Gentleman from Knox.
Thank you, Mr. Speaker. And I would like to thank the sponsor for listening to us over the last couple of months on some concerns that we had in Eastern Kentucky. And also, I'd like to thank him for the hard work that the MOAB committee has done this summer, knowing the dynamics of it and what all is entailed in this bill. This floor amendment just changes one aspect of the 90% rule. What it does is that the agreement, they allow us to spread it out over 4 years. So this gives time for adjustments. And if there's not any questions on this amendment, Mr. Speaker, I'd ask for its approval. I move for adoption.
Motion is for the adoption of House Floor Amendment 18. Is there any discussion of Floor Amendment 18? Gentleman from Jefferson 48.
Thank you, Mr. Speaker. I just want to offer just a couple of thoughts on this amendment. As long as I've been in business, there are many influences that impact a business model. One is competition, which comes from a certain level of dealing with the changing conditions. The other is government laws and regulations. This second factor has a potential to introduce uncertainty and a bit of fear in a business. I truly understand this dynamic and believe it's fitting that we need to do a phase-in of the marginal or the medical loss ratio requirement so that businesses have time to adjust and demonstrate their effectiveness. In addition, House Bill 2 includes that a business operator in this arena must attest to the information they submit is true and accurate. With that, House Floor Amendment 18 is a friendly amendment, Mr. Speaker, and I treasure and value working with the gentleman from Knox for his passion and his insight in making this a better bill.
Motion is for the adoption of House Floor Amendment 18. Is there any further discussion? Seeing none, those in favor signify by voting aye. Aye. Those opposed, nay. House Floor Amendment 18 is adopted. Gentleman from Jefferson.
I will go ahead, Mr. Speaker, and I would like to move the passage of House Bill 2 with House Committee Substitute 1 as amended by House Floor Amendment 18.
Question before the body is passage of House Bill 2 is amended by House Committee Substitute 1 and House Floor Amendment 18. Is there any discussion? Chair recognizes the gentleman from Fayette 45 for discussion of the matter.
Thank you, Mr. Speaker. Will the gentleman yield to a question?
He will yield.
Thank you. Haven't been here long, 2 years so far, but I've heard it said on this floor a couple times that Kentucky is a, quote, poor state. If that's the case, why are we setting state-specific co-payments that are above the federally required minimums?
Gentleman from Jefferson.
Thank you for the question, gentleman from 45. Basically, there's two components. One, it involves accountability and responsibility for the person to take ownership of what they're doing. And part of what my experience is, gentlemen, in running a mental health center, I have looked at quite a few bank statements as I go through and determine if I should waive the cost sharing portion of it or not. And more likely I did waive them, or I reduced the copay significantly in order to help them out, because I am very sensitive to that. So that's one thing. The other thing is, gentlemen, is when you look at the provisions in there, and you might be talking about the $8 that we have. The $8 copay is for those individuals who use emergency room for non-emergency services. That and looking at how much money is spent on the MCOs to try to get people to see their primary doctor, that's about $7.5 million of low priority decisions that's happening in the emergency room that is costing the Medicaid program. That equates about $90 million a year. So trying to get a change of behavior and understanding and change the mindset of these individuals, go see a primary care physician, which under this, there's no cost sharing at all. That's the part of the goal of this.
Gentleman from Fayette.
Wish to speak on the bill?
Yes, sir.
Thank you, Mr. Speaker. I appreciate the gentleman's explanation. I especially appreciate his bringing to light the desire to keep people from having to resort to emergency room care. I had the opportunity to present legislation to him and the members of the Medicaid Oversight Advisory Board in the interim, and we talked about the need for this. It will bring down health care costs if we can keep people healthy without having them to resort to emergency room care. He spoke specifically about that $8 copayment for non-emergency care in an emergency room environment. There are other copays that are established at the state level in this bill as well. Now, we all share a goal of ensuring that the long-term sustainability of our Medicaid program, but we need to be careful that in our pursuit of oversight, that we don't accidentally build a pay-to-play healthcare system that punishes or leaves out the Kentuckians that this program was designed to protect. As written, this bill locks in specific mandatory copayments that do go above and beyond federal requirements. Now, for a healthy individual, a copay might sound like a small amount, but for a Kentuckian who's battling cancer, a grandmother needing regular dialysis, or a neighbor managing heart disease, these are recurring and compounding barriers to life-saving or sustaining care. Decades of research and real-world examples tell us exactly what happens when we raise these financial barriers, that people delay their care. They end up skipping a primary care visit because they don't have the cash on hand, and they wait until a manageable condition becomes a life-threatening crisis. And they end up in the emergency room that the gentleman from Jefferson was referring to, which we all know is the most expensive type of care and the least efficient form of care in our system. By trying to collect a few dollars at the front door, we are effectively choosing to pay thousands of dollars out the back door in emergency costs. Mr. Speaker, could you please ask the clerk to report House Floor Amendment 1?
Clerk, please report.
House Floor Amendment 1 to House Bill 2.
Thank you.
Gentleman from Fayette.
Thank you, Mr. Speaker. House Floor Amendment 1 is a common sense fix to the cost-sharing provisions of this bill, doing a couple things. First, it strips out the rigid state-mandated copayments in the current text, and instead requires that any cost-sharing be established at the minimum level required to comply with federal law. We're frequently, again, reminded by my friends across the aisle that Kentucky is, quote, a poor state, and if that is the case, then why would we choose to impose a greater financial burden on our neighbors than the federal government even requires? Now, secondly, it addresses the long-term stability of our families by protecting them from aggressive medical debt reporting. prohibiting providers from reporting that debt to credit agencies. When a family is already struggling to get by, a medical debt on a credit report can prevent them from securing housing, purchasing a car to get to work, or obtaining a loan, effectively trapping them in a cycle of poverty over a health care bill they couldn't afford. We can have fiscal responsibility without placing an insurmountable burden on those who are living paycheck to paycheck. We can have oversight without creating a system where a Kentuckian has to choose between a cardiology visit and their groceries. Mr. Speaker, I move adoption of Floor Amendment 1 and ask for a roll call vote.
Motion is for the adoption of House Floor Amendment 1. Gentleman from Jefferson 48.
Thank you, Mr. Speaker. I appreciate the thought about this amendment, but I want to remind the gentleman, even though I don't know if he actually said this, that there is a $20 copay that will take effect on October 1st, 2028. Part of the Medicaid Oversight Board is to take in as much information as possible based on the passage of this bill to come up with information for us to make even a smart decision in terms of a path and a process. So with that, if we find through data, through surveys, through whatever information we get, that it's not prudent to do this, we have 2 years, 2 sessions before this takes effect in order to react to that. So that's one thing. The other thing, based on my experience and working with quite a few other mental health providers, they will work with the person in terms of trying to get them make sure they get the service that they deserve and they want, but also to have them understand that there is a participation, sort of a buy-in process of doing that, whatever that might be. If they can set up a payment plan, they can waive it, MCO can waive it. There's several ways you can get around that issue. But I do appreciate that, and Mr. Speaker, I consider this as an unfriendly amendment.
Motion is for the adoption of House Floor Amendment 1. Is there any further discussion on the floor amendment? Seeing none, those in favor signify by voting aye. State your point. Roll call having been called for by 2 or more members. Those in favor vote aye. Those opposed nay. Roll call is open for your vote. Have all members voted? Clerk will take the roll. Being 20 members voting aye, 39 members voting nay, House Floor Amendment 1 fails. Gentleman from Fayette, 45.
Thank you, Mr. Speaker. Clearly, a little disappointed we couldn't come together to pass these protections today, and the record reflects where we stand on this issue as a body, choosing to move forward with a bill that does add some extra expenses. Even though the gentleman has made good explanations, there are these extra expenses that are included in the legislation for Kentuckians who are already facing an unprecedented affordability crunch right now. Again, in a poor state like ours, I think we should do everything in our power to lower the barriers to health and work, not raise them. I cannot in good conscience support a pay-to-play system that treats healthcare as a luxury rather than a necessity for our most vulnerable Kentuckians. Because of this, I will be voting no and encourage my colleagues to do so. Thank you, Mr. Speaker.
Chair recognizes the lady from Fayette, 75, for discussion of the matter.
Thank you, Mr. Speaker. I am rising to call an amendment. I will be calling House Floor Amendment 4. And I'd like to start by telling everyone this does not change the policy of H.R. 1 or the policy in HB 2 at all. Amendment 4 is about accountability, transparency, and protecting Kentuckians as you make these major changes to Medicaid. H.R. 1 and HB 2 make sweeping changes to many parts of the Medicaid program: eligibility, work requirements, cost sharing, and transportation access for Medicaid enrollees. With the changes of this magnitude, we must be honest about the reality. Some Kentuckians will lose coverage, and others might face new barriers to care. But if we measure what we're doing, we will know if it's working. We owe it to the people of the Commonwealth to evaluate where these changes have the largest impact. My amendment, House Amendment 4, requires the Cabinet to track key data moving forward, including reasons for disenrollment, enrollment trends, waivers and exemptions from work requirements, cost-sharing requirements and payments collected, and non-emergency medical transportation data, including trip types, cancellations, and no-shows. This amendment can help us do what we intend to do better. This information will help policymakers identify barriers to care, evaluate whether the reforms are working as intended, and ensure that transportation and cost requirements are not preventing patients from getting to treatment. Without data, we govern in the dark. With data, we can make informed decisions, protect taxpayer dollars, and most importantly, ensure Kentuckians who depend on Medicaid for life-saving care get the care they need. This amendment will not slow implementation, and it does not add red tape or bureaucracy. It simply ensures that as changes take effect, we measure their impact. When coverage is lost or delayed, consequences are not abstract, they're personal and real and permanent. I hope every member of this body can commit to transparency, accountability, and most importantly, evidence-based policymaking. Let's collect the evidence. Your Honor, with that, I ask you to please have the clerk report House Floor Amendment 4.
Clerk, please report.
House Floor Amendment 4 to House Bill 2.
Lady from Fayette.
Mr. Speaker, I would move the body to adopt House Floor Amendment, and I call for a roll call vote.
Roll call.
Motion is for the adoption of House Floor Amendment 4. Roll call vote having been called for. Gentleman from Jefferson, 48.
Thank you, Mr. Speaker. The Medicaid Oversight Board has gone through a lot of deliberation and discussions. In this bill outlines some data that needs to be collected, and that is already embedded in this bill, and I think this language is so duplicating what we already have. Furthermore, I've had extensive conversation with several members on the board that we're going to do extensive work in terms of collecting data and so forth. I appreciate the suggestion, but I consider this as a duplication and unfriendly.
Motion is for the adoption of House Floor Amendment 4. Roll call vote having been called for. Those in favor vote aye. Those opposed nay. Roll call is open for your vote. Clerk will take the roll. Being 20 members voting aye, 40 members voting nay, House Floor Amendment 4 fails. Lady from Fayette, 75.
Mr. Speaker, may I speak on the bill?
Yes, ma'am.
While I appreciate the feedback that this is duplicative, we have reviewed the bill, and the provisions I called for in House Floor Amendment are not there. While they could be in the future, we need them now. And without them in this bill now, we're going to miss a window of important data. What happens right when you initiate a policy is crucially important. House Bill 2 goes beyond what's required by the federal government. And while I might have qualms about what the federal government has done through H.R. 2, my contention is much bigger with our decision to go beyond that. It would make sense to me, when we're talking about the health of Kentuckians, to take principled and slow action. To start with what's required, measure, and then decide if we need to go further. But what I see today is that it's the intention of this body to rush toward kicking people off of health insurance, and I just don't understand why. I'm a no.
Chair recognizes the gentleman from Todd for discussion of the matter. Chair Recognizes the lady from Jefferson 38 for discussion of the matter.
Thank you, Mr. Speaker. May I speak on the bill?
Yes, ma'am.
Thank you. I rise today to talk about a really crucial piece of this bill, the non-emergency medical transport components and needed safeguards. My amendment is House Floor Amendment 7, and it addresses one of the most practical and often overlooked barriers to health care, getting the care and getting to the care in the first place. For many Kentuckians, especially seniors, people with disabilities, and those living in rural communities, emergency medical transportation is the difference between receiving treatment and going without it. This amendment clarifies that eligibility for transportation services will be reviewed at least annually, and when life circumstances change, such as a worsening health condition, loss of access to a vehicle, or when a vehicle becomes inoperable, because when transportation needs change, access to care should not be delayed. It also requires transportation brokers to screen for necessary accommodations and additional stops, including pharmacy pickups. For someone managing chronic illness, picking up prescriptions is not optional, it's essential. And finally, the amendment, alongside hospitals and nursing facilities, allows federally qualified health centers, rural health centers, community behavioral health centers, and certified community behavioral health clinics to provide transportation services. These trusted providers are deeply rooted in our communities, and they serve and are often best positioned to ensure patients arrive safely and on time. Without these provisions, transportation gaps become healthcare gaps, and this amendment removes those barriers, strengthens coordination of care, and ensures Kentuckians can reach the services that they depend on. Because access to healthcare should not depend on whether you have a ride. So, Mr. Speaker, could you ask the clerk to report House Floor Amendment 7?
Clerk, please report.
House Floor Amendment 7 to House Bill 2.
Lady from Jefferson.
I'd like to move for adoption of House Floor Amendment 7 to House Bill 2, and I'd ask for a roll call vote.
Roll call.
Motion is for the adoption of House Floor Amendment 7. Roll call vote having been called for. Gentleman from Jefferson 48.
Thank you, Mr. Speaker. I think it's quite known that the emergency medical transport services is very, very important to transferring people from point A to point B for picking up a prescription or going to an appointment and making sure that the people that are carrying are Medicaid recipients. We also recognize that there's been some issues and problems in pickup and delivery and so forth, and this bill basically outlines in detail in terms of what's required of these contractors. There has not been an audit of these contracts. It's been in place for many, many, many years. It's been handled by the Transportation Department. Even the information that I've gotten from the cabinet is flawed because it says it's a 24% utilization rate, and when you look at and actually did their calculations, it's like 1% to 2% utilization. I would agree there is a significant problem there, and we got to correct that. This bill provides a lot of oversight and a lot of initiative to basically make sure they are doing what they're supposed to be doing. I have confidence that they will rise to the occasion. We put a little higher level bar to make sure that the money that we spend goes to those folks that are in it. My understanding of what your amendment is trying to do is basically looking at having these providers provide car boosters and other carrying other type of items and devices within the car in order to do that. That puts an additional burden on these providers in terms of providing that. So to have that, it's going to be a little more difficult. It's going to cost more expense and takes away to a certain degree dollars in terms of that to the care. So with that, this is an unfriendly amendment, Mr. Speaker. I do appreciate the lady bringing this out because it is a concern of ours, but I think there's additional costs that we need to be conscious of and to help support these individuals that provide this service and not burden them with more costs.
Motion is for the adoption of House Floor Amendment 7. Roll call vote having been called for. Those in favor vote aye. Those opposed nay. Roll call is open for your vote. Clerk will take the roll. Being 17 members voting aye, 35 members voting nay, House Floor Amendment 7 fails. Lady from Jefferson, 38.
Thank you, Mr. Speaker. May I continue to speak on the bill?
Yes, ma'am.
Thank you. I appreciate the gentleman from Jefferson's diligence in addressing the concerns around non-emergency medical transport. It's been a work in progress for a while, and I know you've taken great care to really dive into that issue. I just wanted to add that I think booster seats, anyone who's got a little kid or a niece or a nephew and has to transport them with you to a doctor's appointment because you're their caregiver, really does become vital. And while there might be an additional cost or hurdle to that, I really think that's kind of non-negotiable. If you have to take a little one, we want them to be safe in a car. Or if you have accessibility needs, those need to be accommodated. And while those things are an added expense, I believe that those things are just should be our baseline for what level of care we're providing. So, Mr. Speaker, I think with the changes that the federal government has made to Medicaid, it has really put Kentucky in a tough place, especially this budget season. Our folks rely on Medicaid. I mean, we're a receiver state. We know that this is a primary source of health care for Kentuckians. And so I can't support things that are making it harder for our Kentuckians to receive that care that they absolutely need, and it's vital to their everyday living. So thank you, Mr. Speaker, and I appreciate the opportunity to share.
Chair recognizes the lady from Jefferson, 34 for discussion of the matter.
Thank you, Mr. Speaker. Will the sponsor yield to a question, please?
He will yield.
Thank you so much. Sponsor, I'm concerned about the way that this bill interfaces with people who are trying to access care in an emergency situation or potential emergency situation and their lack of identification. Can you please explain to this body what self-attestation is, please?
Gentleman from Jefferson.
So if I understand the question, you could have slipped a note to me and I can answer your question, but that's okay. I'm teasing you. You can smile.
Gentleman from Jefferson.
Attestation, basically, what we are trying to do when it comes to attesting to the income, the age, those sorts of things. I have seen through my conversations with individuals that there's a lot of fraud out there. I'll give you an example. I had somebody literally in my office show me that they got a qualify for Medicaid at $44,000 a month. Not a year, a month. That's fraud. Second, I have seen where businesses have gone through and have multiple businesses where they pass through all their expenses to it, and they take home $20,000. But they're on Medicaid. Is that fair to you as a taxpayer? Is that fair to all of us? No. That needs to be, that's fraud. That's what part of the main thrust of this bill is to prevent this fraud. Okay, I can go on, and I can go on. Because I tell you what, the Medicaid Oversight Board, we're going to try to flesh this out. And that's what part of this bill is as. We have the state auditors going to come in here and try to flesh that out. So when it comes to attestation, there are hardships. The secretary has the ability to waive that for whatever reason that they see based on that case-by-case basis. So with that, I hope that answers your question, but there's quite a few different things that we're seeing from a fraud point of view, but also the secretary has a capability to give that flexibility to provide that person to have Medicaid if they can't go through and attest things.
Lady from Jefferson, 34.
May I speak on the bill, please?
Yes, ma'am.
Thank you. So my concern is that H.R. 1 already allows states to accept what is called an audible self-attestation. So I will be calling an amendment, which is House Floor Amendment 6, to clarify that Kentucky will still have this common sense practice to align with federal law. It doesn't make sense to me why we wouldn't allow somebody, if they come into an emergency room and they don't have an ID, you should be able to say, my address is 123 Maple Street, and attest to the fact that you are being truthful, so that if you don't have the insurance that you need at that time, the hospital can help you fill out the paperwork. You can have the coverage that you need for the emergency situation that you are in. If we do not allow individuals to do that, We could be putting Kentuckians on the hook for money that they clearly do not have, simply because we would not allow them to state their address. This approach protects program integrity while recognizing the real-world circumstances, because many Kentuckians, including seniors and individuals with disabilities, people working low-wage jobs, and those experiencing homelessness, may not have the immediate access to additional documentation. So if I don't have an ID, I probably don't have the lease to my apartment or the deed to my home or something else to prove that I say I'm living where I'm actually living. Mr. Speaker, would you please have the clerk call House Floor Amendment 6 to House Bill 2, please?
Clerk, please report.
House Floor Amendment 6 to House Bill 2.
Lady from Jefferson.
We should be removing barriers to care and not creating additional ones. And again, H.R. 1 at the federal level allows for this. So there's really no good reason why we should, at the state level, remove this and make yet another barrier for Kentuckians who are already struggling. Mr. Speaker, I'd like to move for adoption, and I call by a roll call vote for this amendment.
Motion is for the adoption of House Floor Amendment 6. Roll call vote having been called for. Is there any discussion? Chair recognizes the gentleman from Rockcastle for discussion of the amendment.
Just got a question. Will the sponsor of the amendment yield to a question?
He will yield.
So it's my understanding under current federal law, a hospital is required to give emergency care to anyone who shows up to their doors. Is there anything within House Bill 2 that changes that you're trying to address? Because it's my understanding hospitals are already required to provide emergency care to anybody that shows up, regardless of the form of documentation they may or may not have.
Lady from Jefferson.
Hospitals, you are correct, I believe. Hospitals will not deny care. My concern is if someone goes to a hospital because they are feeling unwell and they cannot prove they live where they live. They can also choose to leave because if they don't have any sort of insurance, that could put them on the hook for any sort of care that they've received. So not getting the medical care is not necessarily the problem if they choose to stay, because you're correct, hospitals will not deny care regardless of insurance. However, that does not remove the barrier or the issue that an individual could still receive services and then get a bill because they do not have the insurance to cover them.
Gentleman from Rockcastle.
Thank you, Mr. Speaker. I guess I don't understand the issue because it sounds like hospitals are going to continue to provide the care and nothing within this bill is going to stop that. Thank you.
Gentleman from Jefferson 48.
Thank you, Mr. Speaker, and I appreciate the question from the gentleman from Rockcastle. I think he's exactly right. Hospitals are required to provide care when somebody comes into an emergency situation. I also want to bring out a point that the lady mentioned as far as identification and so forth. If you look at Title 42, Section 5, and Part 345, the federal guidelines, there's an item in there that says exemption from special circumstances. I won't go through all this stuff, but basically it says the agency must establish, exempt, and permit case-by-case basis on attestation, and also to help out all those individuals, particularly when individuals are homeless or have a domestic violence or a natural disaster. So they're going to continue to get coverage in order to provide the service and make sure they're in a better spot. And this, Mr. Speaker, this is an unfriendly amendment.
Motion is for the adoption of House Floor Amendment 6. Is there any further discussion? Lady from Fayette 75, do you wish to discuss the amendment?
Yes, sir.
You're recognized to do so.
Thank you. I think the point of clarification that might help on this is that it sounds very much to me like we're asking hospitals to pay for services for people that would get a federal waiver that can't get a state waiver. So because of the way HB2 is crafted, yes, they will get emergency treatment, but the hospital is going to have to bear the cost of that. And we want to cut those costs on our hospitals. So being in line with the federal guidelines would be better for our hospitals, and that's the intent of the amendment. Thank you.
Motion is for the adoption of House Floor Amendment 6. Roll call vote having been called for. Those in favor vote aye. Those opposed, nay. Roll call is open for your vote. Clerk will take the roll. Being 18 members voting aye, 38 members voting nay, House Floor Amendment 6 fails. Lady from Jefferson, 34, you still have the floor.
Thank you, Mr. Speaker. I just want to express my disappointment. I know H.R. 1 at the federal level is going to have devastating consequences to so many individuals, particularly Kentuckians, and I simply just do not understand why at the state level, when there are ways that we can try to mitigate that we would not be doing that. I also want to remind people that there are lots of people who have insurance, who go to the hospital, who get their care, and then they are still in debt with medical debt. So the issue is we don't want hospitals to have to carry the financial burden for a procedure or care that an individual could have gotten if they could have just done an audible attestation of their address so that they could get signed up for the insurance that they currently do not have, and then the coverage would be provided. Thank you so much.
Chair recognizes the lady from Jefferson 43 for discussion of the matter.
Mr. Speaker, may I speak on?
Yes, ma'am.
Okay. The U.S. Constitution creates a zone of privacy, protecting Kentuckians from government intrusion into their private information. This includes poor people. The amendment that I would like to roll call is that it's very simple. It's one sentence, 28 words, and it requires all the medical data that's been transferred from the cabinet to the legislature be de-identified and de-duplicated so that people's private information is protected from the public. It protects, the privacy and the dignity of Kentuckians. It requires them to make sure that they can't be identified when this necessary information is transferred from the cabinet to this legislative body. It means that no personal information will be attached to the information we receive. Medicaid recipients include children, seniors, survivors of domestic violence, individuals managing serious health considerations. They deserve the same level of privacy and respect as any other citizen. Protecting personal health information is not optional. It's part of our U.S. Constitution. This amendment ensures transparency for policymakers. We get the information we need, and at the same time recognizes the dignity of the people and their private information. So I would have that you have the clerk call House Floor Amendment 10, and I request a roll call.
Clerk, please report.
House Floor Amendment 10 to House Bill 2.
Lady from Jefferson.
Again, if we are who we say we are and that the U.S. Constitution applies to all Kentuckians, then this is an easy vote. It's a friendly amendment. We're just saying protect the information of the people who we've requested the information. Why do we need to know their names, their details, their phone numbers, all that information? Depersonalize it and give it to us, but do not strip them of their constitutional rights by saying we don't care. Thank you, Mr. Speaker. Move for adoption.
Motion is for the adoption of House Floor Amendment 10.
Roll call.
And Roll call vote having been called for. Motion is for the adoption of House Floor Amendment 10. Gentleman from Jefferson 48.
Thank you, Mr. Speaker, and I appreciate the ladies' concern and thoughtfulness in terms of confidentiality, and that's very, very important, no matter what we do on quite a few different levels. As a course of business, whenever, in my experience, and I know there's always experience within the government, there are HIPAA laws. And there are other types of confidentiality agreements that are made between entities and so forth. That will be enforced. And we've got insurances from the government that will happen. So I appreciate the effort. I think this is a duplication because that's already existing in terms of having those confidentiality and HIPAA requirements and make sure those names are kept secret and things will be stripped out and edited in terms of identifying those individuals. So with that, Mr. Speaker, I suggest this is an unfriendly amendment.
Motion is for the adoption of House Floor Amendment 10. Roll call vote having been called for. Is there any further discussion on the floor amendment? Chair recognizes the lady from Jefferson 41 for discussion of the amendment.
Just very briefly, Mr. Speaker, thank you. Years ago, the federal government passed HIPAA laws, the Health Information Privacy Protection Act. My background is I was a registered nurse for 38 years, and when those HIPAA laws came into effect, I don't remember the date, but we had to be so careful about protecting patients' privacy. No one in here wants others to know if you've been to the provider for something that you don't want us to know about. So I think what this amendment does, even though, as the gentleman said, it could be duplicative, but I don't think that protecting our privacy and health information can have too many duplications, and that's why I don't think this is an unfriendly amendment. Everyone wants their records private, and to have something get out, I mean, once it's out, it's hard to get back. We all know that, but thank you so much for letting me speak on that, Mr. Speaker.
Lady from Jefferson 43.
Will the gentleman yield to a question about the amendment?
He will yield.
Thank you, sir. Gentlemen, what section are the privacy protections in House Bill 2?
I'll be happy to answer a question on your amendment, and that's section 4B. 4B. 4B.
Lady from Jefferson 43.
Will the gentleman yield to a second question?
He will yield.
So what I hear you saying is these protections are embedded in House Bill 2, and this is duplicative because you already have it in the bill.
Gentleman from Jefferson.
What your suggestion as amendment is, yes, it is a duplication, and furthermore, there's federal law and I would imagine state law in terms of confidentiality and making sure that the information is redacted to not share that private information.
Lady from Jefferson.
So it's clear he's not going to answer the question. In this bill, House Bill 2.
I believe the gentleman did answer your question, lady from Jefferson.
Okay, maybe I didn't hear it right. May I ask him a third question?
He's answered your question, lady from Jefferson.
Because
You
as
can
far as
speak
I
on
can
the, you
read
can
the
speak
bill.
on the amendment, but the gentleman from Jefferson answered your question.
Okay, I will speak on the amendment. As far as I can read it, there are no protections in House Bill 2, and it simply tells the cabinet to give privacy right information to the legislature. Yes, HIPAA exists, but it takes one sentence with 28 words to say, when you give us that information, please make sure you strip out Privacy Act information. There's nothing wrong with that. And if we care about the poor people and their Privacy Act information, we would say, okay, it's not a problem. Let's just do it because we want to protect everybody under the United States Constitution. Thank you.
Motions for the adoption of House Floor Amendment 10. Roll call vote having been called for. Those in favor vote aye. Those opposed, nay. Roll call is open for your vote. Clerk will take the roll. Being 18 members voting aye, 32 members voting nay, House Floor Amendment 210 fails. Lady from Jefferson 43, the floor is all yours.
Thank you. Once again, we have continued our war against poor people, and we've now said that the United States Constitution doesn't apply to them in the state of Kentucky when it comes to their private health care information.
Chair recognizes the gentleman from Laurel for discussion of the matter.
Thank you, Mr. Speaker. Lots of passion on the floor today. Would the gentleman yield to a question?
He will yield.
Mr. Speaker, I'd ask the gentleman, we have 19 amendments filed. Who in this body of the members, the 100 members that we have here, who has met with you on this bill?
Gentleman from Jefferson.
Thank you. The gentleman from Fayette 79 came and talked to me, and I appreciate his openness and coming and talk to me. But beside that, no one.
Gentleman from Laurel.
Would the gentleman yield to another question?
He will yield.
Mr. Speaker, I'd ask the gentleman, who from the Mountain Caucus met with you?
Gentleman from Jefferson 48.
I cannot remember the count of the Mountain Caucus, but there's quite a few of them, and we've had a very lively, entertaining, and a very insightful conversation, which I thoroughly enjoyed. And they hold a special place in my heart because I understand they have some challenges, and so I want to make sure that what we do doesn't inadvertently affect their workforce as well as their folks that they serve.
Gentleman from Laurel.
Thank you, gentlemen. Speak on the bill.
Yes, sir.
Thank you, Mr. Speaker. I have 2 young kids at home, a daughter that's 8, a son that's 3. I drive home most nights. That's 3.5 hours round trip. We've had some long nights meeting with the gentleman from Jefferson, myself, gentleman from McGoffin, gentleman from Perry, gentleman from Letcher, all the Mountain Caucus, gentleman from Knox, of course, who's leading the charge with Amendment 18. We show up when issues matter to our region. And I applaud the gentleman from Fayette 79 for showing up and expressing issues. And I do have some heartburn on this bill, but I am going to vote for it, and I have voted against every amendment up here because you're not working. You're not showing up. You're not meeting with the bill sponsor. If you can't meet with the bill sponsor, then I don't know what to tell you. You're not doing your job. Thank you, Mr. Speaker.
Chair recognizes the lady from Jefferson 32 for discussion of the matter.
Yes, may I ask the sponsor a question?
He will yield.
In House Bill 2, have dental rates been set to make providers more likely to be encouraged to opt in to providing services to Medicaid patients?
Gentleman from Jefferson.
It's a great question, lady from Jefferson. I do appreciate that. That's one thing we've been striving to do, to increase the reimbursement rates, to bring in more dentists into the Commonwealth, as well as keeping them basically providing Medicaid services. That's something I have been working with the leadership of A&R on quite a few occasions, and will continue to work with them and so forth. But this, any type of rate increase or rate modification is not included in this bill. This is more of a policy bill.
Lady from Jefferson 32.
Thank you. May I ask another question?
He will yield.
So I did ask in A&R about my concerns about immediate redetermination of benefits based upon a single data match. So we have a lot of different agencies that are now going to send in data that could trigger a redetermination of benefits. Could you speak on why HB2 has an immediate redetermination of benefits? And you did clarify in committee that it wasn't like an immediate loss of benefits, but an immediate redetermination without giving, say, 30 days for an individual to provide documentation.
Gentleman from Jefferson.
Mr. Speaker, the Department of Medicaid Services already follows eligibility appeal regulations that's required by CMS. This bill does not change that requirement, and so there's still a process in order to go through and to help those folks out. Furthermore, as I mentioned in responding to another question, if there is an issue that comes up, the Secretary has an obligation to look at a hardship or situation in order to address that particular problem or issue.
Lady from Jefferson, 32.
Yes, one more question, if I may.
He will yield.
All right, so my concern is about the returned mail aspect of the bill. So if there is returned mail, then are individuals given a good faith effort to be, or is there a good faith effort that needs to be made to ensure that individuals are contacted via another methodology without this ending in a termination of benefits?
Gentleman from Jefferson, 48.
Mr. Speaker, the MCOs have the responsibility to try to validate the information the best way they can. If they can't validate that, and then there's they'll have additional 14 days in order to try to reach that person before they become disenrolled. I do want to add something, and this goes back to a management issue, lady from Jefferson, which is like I said, it's riddled that there's really not a strong management approach to this. There's nothing to prohibit the cabinet from reaching whatever means they want in order to try it. Get in a car and go find somebody. Get on the internet and send an email. They can do all this stuff. That's thinking outside the box, which to me, the cabinet's not really doing that. And so I encourage the cabinet to try to find whatever means to do that, because we want to try to keep them enrolled to provide that service to them. But I appreciate your conversation about that.
Thank you.
Lady from Jefferson, 32.
Thank you.
Chair recognizes the gentleman from Fayette, 79, for discussion of the matter.
Thank you, Mr. Speaker. Would the sponsor yield to a question?
He will yield.
Mr. Sponsor, I appreciate your time speaking with me this morning a little bit about the hardship waivers. I just want to kind of go through that a little bit. So if I'm understanding some of the differences between H.R. 1 at the federal level, where it sets the unemployment rate and the hardship waivers at 8.5% in these counties, your proposal goes a little bit further to 10%. Is that correct?
Gentleman from Jefferson.
I'm sorry, Mr. Speaker, was that 10% on the unemployment, did you say, or what? Oh.
Yeah.
Gentleman from Jefferson.
Okay, thank you. I appreciate it. I was writing something down. That is a 10%. Now, we got that information and that level from from the SNAP program, in order to we put that in there. But I have mentioned to a couple of people that, and I think just a moment. The lady from lady from Fayette. I'm sorry. Thank you for waving your hand. I had it in my mind, but I just want to make sure. She brought that point in A&R, or made a point about that, and I understand the situation, particularly when it comes. I just mentioned the Mountain Caucus. They've got a high unemployment rate. We need to provide whatever we can in terms of helping them out. I'm going to take it myself to maybe work with the Senate to maybe get that down to 8.5 in order to help make that a little easier.
Gentleman from Fayette.
Would he yield to another question?
He will yield.
Thank you, Mr. Sponsor. I appreciate that. I appreciate your willingness to work with the Senate to get that back down to 8.5. I think that would greatly improve this bill. I guess my follow-up question is, I know that in H.R. 1, per our conversation, that that bill allows our cabinet secretary to grant those hardship waivers. If H.R. 1 were to go away, let's say there's a change in administration, there's change in federal policy, and H.R. 1 were to go away, would that still, as it sits, allow our cabinet secretary here to continue those hardship waivers?
Gentleman from Jefferson, 48.
Yes, it will, but to be honest with you, gentlemen, I would like to get that clarified to make sure we put that in a future bill in order to make sure that happens. But you bring up a good point, though.
Gentleman from Fayette.
May I speak on the bill?
Yes, sir.
Thank you, Speaker. Sponsor, appreciate the conversation. I've got good news. I've got an amendment that will do it right now for you. You don't have to wait about it. We talked about bingo this morning. We've got a lot of red on here. I'll give you another green. We'll say bingo. We'll call it all. House Floor Amendment 16 provides those exemptions that we just talked about, where HB2 currently goes a little bit further down to up to 10%. This brings it back into the federal guidelines of 8.5%, and then it would put into federal or into state statute, giving our cabinet secretary in the future, if HR 1 went away, the ability to continue those hardship waivers. So since this has already been called something he's willing to work on and a friendly amendment, I don't know why we couldn't go ahead and take care of it today. So I move for the clerk to report House Floor Amendment 16, and I ask for a roll call vote for this super friendly amendment.
Clerk, please report.
House Floor Amendment 16 to House Bill 2.
Gentleman from Fayette.
I'm good. Let's vote.
Gentlemen, you have to make a motion.
I move that we adopt House Floor Amendment 16.
Motion is for the adoption of House Floor Amendment 16. Roll call vote having been called for. Gentleman from Jefferson 48.
I do appreciate that, the good gesture and so forth. There might be some other things I might want to look at and change, so I'd like to go. I'm not saying it's a bad idea, but I'm going to say it's an unfriendly amendment because I know you're disappointed, and I'm sorry we don't have bingo, but we did House Bill 18, well, that was a bingo, so we did got it straight down. But anyway, I do appreciate that, but there are some other things we might want to tweak in there, and I'm going to roll that in with the other one. So I'm going to go ahead and have this as an unfriendly amendment for right now.
Motion is for the adoption. House Floor Amendment 16. Roll call vote having been called for. Those in favor vote aye. Those opposed nay. Roll call is open for your vote. Clerk will take the roll. Being 25 members voting aye, 25 members voting nay, the motion fails. Gentleman from Fayette 79.
May I speak on the bill?
Yes, sir, you may.
Okay. Well, I want to thank the members of this body who listened to the conversation and voted affirmative with me. We had a pretty bipartisan vote on that bill, and it got us to a tie. That's pretty positive for somebody in my position. I do want to talk about some of the substance today in this bill. We've talked about how this bill just affects the expanded Medicaid population since the Affordable Care Act went into place, and that is absolutely correct. But you see, what happened in Kentucky when we expanded the Medicaid back in about 2013 or so, we had a 14.3% unemployment rate. And since then, we've dropped to 5.4. So we as a Commonwealth have made tremendous strides in attacking and helping those folks who are most vulnerable in our society by getting them on Medicaid. And I agree there needs to be skin in the game, shared interest, and accountability, responsibility, and we need to get people away from going to the emergency room, meeting with a primary care physician every time possible. But the provisions in this bill that go above and beyond HR 1, they're just not needed. They're not needed. We're going a little too far. There are things in this bill that I agree with, but you have to vote on the piece of legislation in total, and we're going to hurt our people again. We're hurting the same people that we continue to hurt every time we pass these kind of bills. And so I know we've had a lot of conversation today, but Medicaid covers a vast number of our people throughout the Commonwealth, and I'm just worried what it's going to do to our rural hospitals, and it's going to do to our areas that are economically distressed already. So I'm voting against this bill today, and I encourage y'all to do the same. Thank you, Mr. Speaker.
Chair recognizes the lady from Jefferson 41 for discussion of the matter.
Thank you, Mr. Speaker. I have a couple of questions, and I'd like to speak on the bill. Go ahead.
Fire away.
And keep that gavel under there, okay? Thank you, Mr. Speaker. Gentleman from Jefferson 48, why did House Bill 2 not take a trip over to the Moab Committee?
Gentleman from Jefferson 48.
I was some chatter back here, and I'm sorry to could not hear your question.
Oh,
Could you
sorry.
repeat that, please?
Jefferson, would you repeat your question?
Why did House Bill 2 not take a little trip to the Moab Committee?
Gentleman from Jefferson 48.
I like that coin, taking a trip. Moab Committee started in June of last year, and we went through quite a bit of discussions, had many stakeholders that come in, the cabinet, and gone through a lot of discussions in order to get something that we can recommend. The Moab Medicaid Oversight Board, just like the Public Pensions Board, makes recommendations to the General Assembly, and that's what their function is doing, and that's what it did. Now, let's take a little step further, madam. If you look at the findings, there's 11 findings in there. Finding number 1, administrative process efficiencies and negatively affect service, operations, service delivery, and provider participation. I won't go through. That's covered in section 5 to 9, as well as in sections 15 and 16. Finding number 3, Medicaid budget growth is unsustainable. That's in sections 21 to 23. That involves looking at the audit to try to come up with some good understanding in terms of weeding out the fraud. Finding number 6, inefficient transparency in the Medicaid spending performance. That's in section 18. When you look at network adequacy reporting, that's inaccurate and lead to insufficient access to medically necessary services, that's finding number 7. That's in sections 10 to 13, 25, and 26, and that's basically laid out what the lady from Kitten 64 pointed out. Finding number 8, current Medicaid delivery model is in place in 2021 is not significantly improving healthcare outcomes. That goes back to, once again, sections 10 to 13, as well as section 14. So you can see that we went through and took at least 7 out of the 11 recommendations and the findings from Medicaid that went over to into this bill.
Lady from Jefferson 41.
Thank you, gentlemen, and thank you, Mr. Speaker. And I had one other question, and then I'd like to speak on the bill, but
He will yield.
thank you. Is there anything in the bill that would examine provider fraud? Or do we have a task force or a committee that would look at provider billing, provider fraud?
Gentleman from Jefferson 48.
Madam, you gave articles in the Moab, several months ago, and I thank you very much. Got a little interference here. Can't see it. But I did read those articles, and I do appreciate it. And yes, the part of the process we're looking at is with the audit, and also in the transparency in the dashboard, because in that particular measure, basically it has performance measurements of providers. That's going to be part of making sure that they are meeting up to their expectations in terms of providing performances and so forth. But it's going to be more the audit side of it in order to try to flesh that out. Now, also, I'll mention something else. That's going to be a continued conversation when it comes to Moab discussions this coming summer in order to deal with all that. You make a very good point. There are some fraud issues that we are concerned with, but I've seen that. In fact, I mentioned a few minutes ago. But I do thank you for the question and pointing that out.
Lady from Jefferson.
Thank you, Mr. Speaker. And the reason I asked this question, what the gentleman referred to in the Moab Committee, as everybody has iPhones and you can Google fairly easily provider fraud cases in Kentucky. And I looked back several years, however, and found $2.1 billion of provider fraud. And these are people that we respect, that you would go to for chest pain or whatever, or dialysis. But several have been sent to court, they've been fined, they've been sent to prison. for unnecessary heart catheterizations. They can kill you. Giving people chemo when they don't have cancer. That's kind of a fraud, I would say. But you can bill thousands of dollars for chemo. And if you don't get caught, you know, you can have a Mercedes and lots of vacation homes. And several years ago in Louisville, Kentucky, there was a couple that were selling vials of heparin to companies illegally and overpriced, and they got busted, and they had to give up their home and their fur coats, and they went to prison. It was a very sad story for them, but I wasn't too sad about it because, you know, I hate to see our government defrauded. But that's why I was asking that question and why I worry about why we look at our Kentucky citizens that are in poverty and struggling and not look at providers and come down hard on them, because I can't imagine anybody going and filling out paperwork and trying to get a Medicaid card. I mean, unless you were really in poverty, why would you want to have a Medicaid card, really? But I just can't imagine that. But I found a lot less fraud with Medicaid actual people. It was like 200 million, but there is fraud, and we do need to find it. I agree. But I'm afraid that this bill will... May I speak on the bill, Mr. Speaker?
Yes, ma'am.
I'll be brief. I'm really afraid that this bill will affect our population, which we know Kentucky is very, very poor, not only in rural Kentucky, but in urban areas as well. But it'll affect nobody in this room, because we all have great health insurance, and we make our appointments, and we might have a copay here and there, but we certainly can't afford it. So it's not going to affect any of us, and probably none of our families. But let me tell you, it's going to affect a ton of Kentuckians. And it's going to be devastating that people are living on the edge that have a $20 copay. I mean, to you, $20, I mean, that's lunch or breakfast. But when you're one flat tire away from declaring bankruptcy, $20 might as well be $5,000. So I think what we're doing now is punishing people for being poor. And lastly, I have a dear, dear friend who has a son who has a severe mental illness. His parents bought him a condo, which he sits in. She has to go to the grocery for him. He won't go out because he's got a severe mental illness. He thinks the government has planted chips in his head. He's on Medicaid, and she has to go over there and find the mail if she can find it, because if he gets anything that has any official state of Kentucky or federal government on it, he hides it or he throws it away because he thinks they're trying to get into that chip in his head. Now, how's this fella going to be able to meet work requirements of 80 hours a month? For number one, he won't go out of his apartment. Number two, who's going to hire him? Not me, but we have a ton of people like this in Kentucky that are severely mentally ill, are using substance abuse disorders, people on dialysis that don't know how to fill out paperwork. I mean, I have a hard time filling it out when I go to the doctor. So I think this is a way that we're punishing our poor people and accusing them of fraud when it really exists more on the provider side. So y'all Google Kentucky fraud by providers. You'll find it. And, you know, I'm going to make a prediction. And a lot of people think I'm a witch, but maybe I am. But I'm going to make a prediction that this bill is going to really devastate Kentucky. Not today, not tomorrow, but over the next couple of years, especially in pockets of poverty. Our hospitals are going to suffer. Our poor people are going to suffer. Our clinics are probably going to be closing. Our hospitals are going to reduce services, and if you are going to have a baby or you're going to need a hip repair, you're going to have to drive 3 or 4 hours through the mountains from western Kentucky up to Louisville to get your care. because there's not going to be a place to get care because they're going to be gone. But my prediction is in the next 3 or 4 years, and maybe many of us will be not legislators anymore. We won't have to deal with it. The folks won't be calling you. But it's going to happen, and this is going to devastate our population. We need to lift people up. We need to provide jobs. We need to spend that money on issues that will help our folks, that will keep them healthy, keep them well. Food is medicine, as we passed in the lady from Kenton's committee, thank you, the other day. So there's so many things we can do that are low cost, that'll help our folks. But I'm sorry, but I don't think this is it. But my prediction is in the next 3 years or so, our state will be in a huge mess of folks needing health care, not getting health care, dying of things that could have been prevented. And I cannot vote for this bill in good conscience. Thank you, Mr. Speaker, and you didn't need your gavel today, I don't think.
Hearing lady. Chair recognizes the gentleman from Campbell 67.
Thank you, Mr. Speaker. May I ask the gentleman from Jefferson a question, please?
He will yield.
Yeah, thank you. I just was curious if the big managed care organizations or any of the MCOs currently working in Kentucky, have you received feedback from any of them?
Gentleman from Jefferson.
If I understand your question, did I get any feedback from the managed care organizations? Yes, I've met with several of them on their thoughts.
Gentleman from Campbell.
Can I ask a follow-up to that, please?
He will yield.
I just curious what their feedback was. I mean, is there a risk that MCOs may back out of Kentucky with some of the changes in this bill?
Gentleman from Jefferson.
Gentlemen, they're under contract until the contract ends. I'm not an attorney. They can back out if they want to, but I imagine there might be some penalty terms and conditions in order if they do back out. They did express some thoughts and concerns about some of the provisions in there, particularly when it comes with what the lady lady from 64 laid out a few minutes ago. Also, I just want to let you know that as much as the Medicare organizations try to do their best, we've got an output. We've got outcomes of healthcare that's been flat for many, many years. And we've been funneling in a lot of information and a lot of funds in order to have this organization manage the care. And we really haven't gone anywhere. I don't know, we need to change the structure of the contract or change whatever. But it's really, they need to do a better job. And I think they realize. Now, there are several areas that do a good job. But overall, and looking at things in its totality, there is concerns in terms of performance and those sorts of things.
Gentleman from Campbell.
Thank you. May I speak on the bill?
Yes, sir.
And I don't know if I'd say commend, but I would certainly like to acknowledge that the gentleman from Jefferson's work on this, and I think everyone else involved. I mean, without a doubt, this is trying to tackle the most complicated, screwed up part of American society. Nobody likes our healthcare system. I mean, doctors don't, nurses don't, patients don't, taxpayers don't. You know, we're obviously put in a really tough spot with the federal changes. I've seen numbers that we're going to lose anything from $800 million to $2 billion a year in federal funding to address our Medicaid and kind of the expanded Medicaid population and the marketplace. So I do have to acknowledge how hard this has been. I just want to highlight, I think, with my experience, I found it interesting. So I worked in California a couple years. I was actually self-employed there. Moved back to Kentucky in 2015. I was self-employed and started a company. And of course, everything when I moved from California back to Kentucky got a whole lot cheaper, except for one thing. and it was my health insurance. You know, we are sicker and we are poorer than a lot of people in this country. And, you know, there is a part of the population here that's going to be really adversely affected, and it is our self-employed entrepreneurs and small businesses who do rely on the expanded Medicaid. And I know this doesn't directly affect the marketplace, but what happens with the expanded Medicaid does indirectly affect that population. You know, we have seen that, and this is with states across the country that have the Medicaid expansion population, which Kentucky did, and they try to remove barriers to that. You see self-employment increases anywhere from 14 to 22%. You see greater risk-taking. People are more interested and willing to lose their jobs if they feel that they can be protected, to at least have health insurance. And about 19%, and again, this isn't Kentucky specific, but this is all of all states that have the expanded Medicaid, about 19% of the people in that expanded population work at small businesses. So I just highlight this, you know, this isn't just, I feel like sometimes we just throw this as these are people taking advantage of something, or somehow they haven't earned something. From people who are truly disabled or can't find a job to people who are trying to start a new company. This really provides a baseline of support. So I'd like you to please consider this as this goes forward in the Senate, and as well as goes forward. And I assume the Medicaid Oversight Board is going to continue on because, as you mentioned, it is the second biggest expense in our state, and it is absolutely vital to our livelihood. So I just appreciate you taking that under consideration, and thank you.
Chair recognizes the lady from Fayette 93 for discussion of the matter.
Thank you, Mr. Speaker. May I speak on the bill?
Yes, ma'am.
Thank you. I want to begin by acknowledging that there are provisions in this bill that I appreciate and I strongly support. Expanding support for mothers by covering maternal mental health coverage, lactation consultants, and breast pumps are good things, and these are known things that help improve maternal outcomes as well as infant outcomes. I hope that these provisions stay in the bill in the final version, and I also agree with the stated intent of this bill. We should always be looking for ways to improve accountability and efficiency in government. I believe that all of us in this body share a common objective. Medicaid should be responsible, transparent, and focused on delivering real health outcomes for Kentuckians. Where I disagree is the direction this bill takes regarding access. Fraud exists, we know it. We've heard about it from the lady from Jefferson and from the bill sponsor. But it's the exception, it is not the norm. But we have been sold a myth that there are countless able-bodied individuals that, for whatever reason, stay chronically unemployed in order to draw Medicaid benefits. The reality is that the overwhelming majority of able-bodied Medicaid recipients are already employed or are continuing to seek employment. This bill does very little to address the fundamental structural issues within our healthcare system. And instead it burdens the working class families and the poorest Kentuckians with administrative red tape and barriers. But when we make significant structural changes to a system that serves our most vulnerable citizens, we have got to be extremely careful that we are not creating new barriers to care. Even well-intended reforms can make it harder for eligible people to access the medical services that they rely on. As a legislative body, we should not take steps that risk making access to health care more difficult for vulnerable Kentuckians. And for that reason, I respectfully vote no.
Question before the body is passage of House Bill 2. Is amended by House Committee Substitute 1, House Floor Amendment 18. Clerk will sound the chimes. Those in favor vote aye. Those opposed, nay. Roll call is open for your vote. Have all members voted? Chair recognizes the gentleman from Warren 17 for explanation of vote not to exceed 2 minutes.
Thank you, Mr. Speaker. I'd like to rise to commend the gentleman from Jefferson 48. House Bill 2 is the culmination of hours and hours of detailed research and evaluation. We have an obligation to care for the most vulnerable, and we must ensure the Medicaid program is sustainable for years to come. This bill does just that. The gentleman from Jefferson 48 has actively involved other members in this process because he understands the best product is achieved when we all work together. He has demonstrated hard work, innovation, and collaboration, and that is leadership at its finest.
Chair recognizes the gentleman from Jefferson 42 for explanation of vote not to exceed 2 minutes.
Thank you, Mr. Speaker. I do want to also commend the gentleman. I know that this is a hard policy work and it is not decisions that we should make lightly. I'm a no on this today because I do believe that there are several parts of it that will have unintended consequences and will make access difficult for folks in my district and people all over the Commonwealth. And I will just also add, Mr. Speaker, that policies such as Medicaid, which is very complex and complicated, does require a lot of time and a lot of careful decision making. And I hope that the gentleman from Jefferson will allow me to continue to learn more about some of these changes, and hopefully our colleagues in the Senate will make the changes necessary to make it better for all the people of the Commonwealth. Thank you.
Chair recognizes the lady from Jefferson 43 for explanation of vote not to exceed 1 minute.
Thank you, Mr. Speaker. I voted no on this bill because we should be making health care more accessible. You can't be a human being in a body and not need health care. That we take our most vulnerable people and tell them, you've got to jump through these hoops, you've got to do this. If we know there's fraud, why not go after the clinics that are defrauding the government? Why not go after the people that are defrauding the government instead of making all the people pay? Health care is indispensable, and we find ourselves today where a lot of the amendments were agreed with but not adopted, and we have to ask ourselves the question, why? If we are who we say we are, if this body is really responsible for the least of these, as we always say, the most vulnerable, we say the right words and then take the wrong action. Thank you.
All members voted. Clerk will take the roll. In 77 members voting aye, 21 members voting nay, House Bill 2, as amended by House Committee Substitute 1 and House Floor Amendment 18, is passed. Gentleman from Jefferson 48.
Mr. Speaker, would you mind just take one moment, personal privilege? To
You have the floor, gentlemen.
To thank some people.
Thank you very much,
Mr. Speaker. I want to thank a couple of people that helped put this thing together. Without their valuable input and thoughts and insight, a lot of things probably would not happen. The drafter, Chris Jofreon, I always mispronounce that. He is very patient and helped us out. The former Arkansas Secretary Chrissy Putnam is very, very good, and I appreciate her insight. And in all due respect, Mr. Speaker, I call Ms. Bates the queen bee of Medicaid because she is very, very knowledgeable. Without her input and thought, this lot of stuff would not happen. Her passion, her professionalism, but also her patience in dealing with me to get this thing through. So thank you very much, Mr. Speaker, and I move for the clincher.
Without objection, clincher is pled. Gentleman from McCracken.
Mr. Speaker, I yield to the clerk of the Senate.
Chair recognizes the clerk of the Senate. Good Friday morning, Madam Clerk. Tell us of the good works of our comrades down the hall.
Good Friday morning to you, sir. The Senate has passed House Bill 1 and is returning same to this honorable body.
Good work, Madam Clerk. Thank you.
I try, sir. Thank you.
Gentleman from McCracken.
Mr. Speaker, that concludes the orders of the day.
Next order of business is motions, petitions, communications, and announcements. Gentleman from McCracken.
Mr. Speaker, I move you, sir, that House Bill 619 be taken from the Committee on Appropriations and Revenue, given its first reading, and then returned to the Committee on Appropriations and Revenue.
Without objection, so ordered. Clerk, please report.
House Bill 619, Representative Bray, an act relating to public post-secondary education.
Gentleman from McCracken.
Mr. Speaker, I move you, sir, that House Bill 651 be taken from the Committee on Natural Resources and Energy, given its first reading, and then returned to the Committee on Natural Resources and Energy.
Without objection, so ordered. Clerk, please report.
House Bill 651, Representative Bray, an act relating to public water and wastewater systems and declaring an emergency.
Gentleman from McCracken.
Mr. Speaker, today is February 27th. And a lot of people in my family have birthdays today, including my brother Matt, who turns 50. His daughter, Lexi, turns 28. She stole his birthday 28 years ago. But this place is like family as well. And another brother that I have, a brother from a different mother, the gentleman from Todd, his birthday is today. And I'll tell y'all something about the gentleman from Todd. He's in a much better mood when his lovely bride, Denise, is with him in Frankfurt. So if you're trying to get in with him, find out first if she's in town. And he's much nicer then. But Mr. Speaker, with that, I now need to yield to the gentleman from Bullitt. I believe he has some work done in the Enrollment Committee.
Chair recognizes the gentleman from Bullitt, who has been busy in the Enrollment Committee. Gentleman from Bullitt.
Thank you, Mr. Speaker. The Enrollment Committee has met and found the following bill to be in order and ready for your signature. House Bill 1.
Thank you, Mr. Chairman.
Thank you.
Gentleman from McCracken.
Mr. Speaker, that's all I have for motions, petitions, communications, and announcements.
Chair recognizes the gentleman from Hopkins. For what purpose, sir?
I'd like to withdraw a couple bills, Mr. Speaker.
Yes, sir.
Mr. Speaker, I move that House Bill 247 and House Bill 659 be withdrawn. I'm the primary sponsor, and I filed the proper paperwork with the clerk.
Without objection, so ordered. Chair recognizes the lady from Kenton 65. For what purpose, ma'am?
To act on a citation.
Yes, ma'am.
Please have the clerk report by title only, citation number 49.
Clerk, please report.
Citation 49, Representative Dietz, citation of appreciation. The House of Representatives of the Commonwealth of Kentucky hereby recognizes and honors Mayor Ron Washington.
Lady from Kenton.
Thank you, Mr. Speaker. As we come to the end of Black History Month, I rise today with great pride to honor a remarkable leader in the Commonwealth of Kentucky, the Mayor of Covington, Ron Washington, for being not only the first African American to serve as Mayor of Covington, but the first to serve as Mayor of any of Kentucky's 5 largest cities. As the state representative for Covington, it is my privilege to represent a city rich in history, resilience, and progress. And in this moment, we recognize a mayor whose leadership reflects the very spirit of Black History Month: perseverance, service, and a commitment to lifting others as he climbs. Mayor Washington has dedicated his life to public service, not for recognition, but for results. Under his leadership, Covington has continued to grow stronger through economic development, neighborhood investment, public safety initiatives, and meaningful community engagement. He has worked to ensure that every resident, regardless of background or zip code, has a voice at the table and an opportunity to succeed. His journey to becoming mayor is itself a testament to progress. His leadership stands as an example to young people across northern Kentucky that service matters, character matters, and representation matters. Black History Month is not only about reflecting on the past, it is about recognizing those who are actively shaping a better future. Mayor Washington's work embodies that purpose. He leads with integrity, with compassion, and with a deep love for Covington. So today I ask this body to join me in honoring Mayor Ron Washington for his accomplishments, his leadership, and the example he sets for the Commonwealth. Mr. Speaker, I move for adoption.
Without objection, so ordered. Thank you, lady from Kenton. Chair recognizes the lady from Jefferson 37. For what purpose, ma'am?
Speaker, to withdraw a bill.
Yes, ma'am.
Mr. Speaker, I move that Bill 764 be withdrawn, and I am the primary sponsor, and I filed the paperwork with the clerk.
Without objection, so ordered. Chair recognizes the lady from Jefferson 44. For what purpose, ma'am?
Thank you, Mr. Speaker. To read a citation, please.
Yes, ma'am.
If you could have citation number 050 read by title only.
Clerk, please report.
Citation 50, Representative Chester Burton and Representative Brown. Citation of appreciation. The House of Representatives of the Commonwealth of Kentucky hereby recognizes and honors State Representative Pamela D. Stevenson.
Lady from Jefferson.
Thank you, Mr. Speaker. State Representative Pamela Stevenson, during the 2026 regular season of the Kentucky Assembly, for her years of exemplary service as a vital member of this body, where she has most ably represented the interests of House District 43 and the citizens of Jefferson County since being elected in the position in 2021. Representative Stevenson is an honorable veteran of the United States Air Force, where she served her country with great valor for 27 years as the Judge Advocate General before ultimately retiring with the rank of Colonel. She is a graduate of Indiana University in Bloomington, who she also earned her Juris Doctor degree from IU Maurer College of Law. And she is an ordained Baptist minister and associate pastor of Oak Grove Missionary Baptist Church, the founder of the Stevenson Law Center, which offers legal representation to veterans and seniors, and a former adjunct professor at the University of Louisville Brandeis School of Law. She currently serves as the respected minority floor leader, where she is the first African American woman in Kentucky's history to hold the post. Over the course of her career in public service, she has earned a stellar reputation among her constituents and colleagues as an extraordinary orator and impassioned supporter of equality and justice for minority groups and the disenfranchised. Insomuch as the State Representative Pamela Stevenson is a public servant of the highest honor who has continually utilized her time, talent, and resources for the betterment of her community and the lives of its residents. The members of this body are deeply honored to join Beverly Chester Burton and Representative George Brown in honoring her sincere commendation and gratitude for her years of exemplary service and extending her best wishes for future success and good fortune as she continued to labor so diligently in the interest of the common good. I move for adoption.
Without objection, so ordered. Chair recognizes the gentleman from Fayette, 77. You sure you want to follow that gentleman?
I do the best I can. I have a little known Black history fact. Since today is the last day of Black history, I wanted to recognize a friend of mine. I've become friends with him recently in the last few years. Wilbur Hackett Jr. was born in Winchester, Kentucky in 1949. He was the first African American to start in any sport at the University of Kentucky, and in 1969 was the first to be named a team captain. He was one of the first African American football players in the Southeastern Conference. He is a 1999 Hall of Fame inductee at Manual High School in Louisville, Kentucky, where he was a linebacker and running back on defense. No, that's not right. He was a linebacker on defense and a running back on offense. He was considered the best all-around football player in the city. In 1966, Hackett was All-State, All-Southern, and Parade Magazine All-American. He helped break racial barriers in college football. Hackett was one of the early African-American players to integrate the SEC in football and helped open doors for future athletes. His courage and leadership made him a pioneer of integration in Southern college sports. He faced racism and death threats during his career because he was one of the first African American players in the SEC. Hackett received death threats and sometimes needed protection at games. There was a story that he played against Archie Manning and knocked Archie Manning out at the University of Mississippi in a game in Oxford. And he needed protection as a result of that. He graduated from the University of Kentucky. Decades after playing, he returned to school and earned his degree in 2020, nearly 50 years after finishing his football career. He worked at Toyota Manufacturing and stayed involved with the university. Hackett later worked at Toyota and served as a community advisory member for University Athletics and was notably an official. I'm not sure what the position was in the Southeastern Conference, but giving tribute to Mr. Wilbur Hackett Jr. Thank you, Mr. Speaker.
Thank you, gentleman from Fayette. Any other member seeking recognition in motions, petitions, communications, and announcements? Seeing none, the next order of business, introduction of new bills and resolutions. Clerk, please report.
House Bill 776, Representative Derek Lewis, an act relating to the practice of dentistry. House Bill 777, Representative Wilson, an act relating to sports wagering. House Bill 778, Representative Wilson, an act relating to child welfare. House Bill 779, Representative Massaroni, an act relating to education. House Bill 780, Representative Elliott, an act relating to recording of deeds. House Bill 781, Representative Lockett, an act relating to the Supplemental Nutrition Assistance Program, Education and Training Plan. House Bill 782, Representative Watkins, an act relating to post-secondary education students. House Bill 783, Representative Grossberg, an act relating to school bus stops and declaring an emergency. House Bill 784, Representative Emily Callaway, an act relating to fetal homicide. House Bill 785, Representative Payne, an act relating to solar farms in the Commonwealth. And House Bill 786, Representative Watkins, an act relating to Medicaid eligibility.
Thank you, Mr. Clerk. Next order of business, meeting of Committee on Committees and the Rules Committee. Gentleman from McCracken.
Mr. Speaker, I move you, sir, that the House would be in recess for a meeting of the Committee on Committees at the clerk's desk.
Without objection, the House will stand in recess for meeting of Committee on Committees at the clerk's desk. House come to order. Next order of business, report of Committee on Committees. Clerk, please report.
The Committee on Committees has met and referred to Appropriations and Revenue, House Bill 688, to Health Services, House Bill 689. And the Committee on Committees has reassigned to Appropriations and Revenue, House Bill 651, from the Natural Resources and Energy Committee.
Thank you, Mr. Clerk. Next order of business, introduction of floor amendments. Please report.
House Floor Amendment 1 to Senate Bill 101, Representative Burke.
Thank you, Mr. Clerk. Next order of business is adjournment.
Thank you,
Chair
Mr.
recognizes the gentleman from Clark at the gentleman from McCracken's desk.
Thank you, Mr. Speaker. I move that the House shall stand adjourned until 4 p.m. Monday, March 2nd, the year of our Lord, 2026.
Without objection, the House shall stand adjourned until 4 p.m. Monday, March 2nd, the year of our Lord, 2026.